Hey everyone! Welcome to our latest STEM Fellowship video, where we'll be breaking down a field that has become especially relevant in the past months since the outbreak of the COVID-19 pandemic, epidemiology. This is going to be the first video in a mini-series, so today we'll be briefly going over what exactly epidemiology is, and we'll be discussing a bit of history as well. We'll also touch on the current relevance of epidemiology, which I'm sure some of you can already guess. So, what exactly is epidemiology? Epidemiology is the branch of medicine which deals with the incidence, distribution, and possible control of diseases and other factors relating to health. That sounds really complicated, but a simpler way to think about it is like this. A typical doctor has a patient who they study and treat. An epidemiologist patient is the entire population. They study the causes and consequences of health-related events that affect large groups of people. One example of a health-related event that affects many people is an infectious disease. Lately, you might have been hearing the words epidemic and pandemic or even endemic being thrown around. So you might be wondering, what do these words mean exactly? An epidemic disease is affecting many persons at the same time and spreading from person to person in a locality where the disease is not permanently prevalent. It occurs at the level of a region or community. A pandemic disease is an epidemic that has spread over a large area. That is, it's prevalent throughout an entire country, continent, or the whole world. Endemic is an adjective most commonly used to describe diseases regularly found and restricted to a particular location, region, or population. As you may have guessed, the role of epidemiologists has been extremely significant in the past year with the outbreak of the COVID-19 pandemic. Unfortunately, COVID-19 is certainly not the first and won't be the last virus faced by humanity. The first known pandemic occurred during the Peloponnesian War in ancient Greece. Coined the Great Plague of Athens, this deadly epidemic swept through the city in 430 BC. Records of the disease are limited, but we know that the epidemic originated in sub-Saharan Africa, then spread north and west through Egypt and Libya across the Mediterranean Sea into Persia and Greece. Most of the population was infected, and perhaps as many as 75,000 to 100,000 people died. The Black Death, also known as the Plague, is one of the deadliest diseases in human history. Its first outbreak was recorded in 542 AD, but the cause behind the disease wasn't identified until 1984. The bubonic plague is the most common form of the disease, but if left untreated, can advance to pneumonic and septicemic plague, which are highly infectious and kill almost 100% of those infected. Outbreaks of the plague still occur today, but the 14th century pandemic is particularly infamous. This outbreak likely emerged from China in 1334, then spread along trading routes to Europe via Sicilian ports. It killed more than 25 million people, and it's believed that the disease lingered in cities until the late 17th century. Amongst the overwhelming death tolls, however, the 14th century Black Death pandemic revolutionized the world. The deaths left labor shortages, which led to higher wages and increased freedom for the working class. Failure of authority figures to protect their people from the plague spurred questioning of social and religious structures. This was also when morbid themes started to emerge in art. Of note, one of the most significant results of the Black Death is a concept we are familiar with, quarantine. This understanding of how infectious diseases spread between people and the idea that you could stop its spreading by isolating sick individuals reshaped public health and, of course, still impacts us today. The Spanish influenza has a reputation as the deadliest flu in human history, killing young, old, and healthy people alike. It emerged during an unfortunate time following the end of the First World War, which had left the entire world vulnerable, malnourished, and overcrowded. The devastating properties of the H1N1 virus that causes the influenza are still not understood. At the time, antibiotics for secondary bacterial infections were more than a decade away. Mechanical ventilators were unheard of, and there was no vaccine to protect against infection. The control efforts worldwide were limited to non-pharmaceutical interventions. Significant developments include the widespread popularization of face masks and hand hygiene. As well, during the outbreak, mass gatherings were canceled and social distancing was aggressively enforced, which we also see today. Unfortunately, even with these interventions in place, the Spanish flu killed more than 50 million people. It is interesting to note that in the United States, cities that committed earlier, longer, and more aggressively to the interventions mentioned above not only saved lives, but also emerged economically stronger. The current COVID-19 pandemic is the third coronavirus outbreak the world has experienced in the past 2 decades. The first with the SARS coronavirus, identified in 2003. MERS, another species of coronavirus, was reported in 2012, but we'll be focusing on SARS. The SARS epidemic affected at least 29 countries and resulted in more than 8,000 cases and around 800 deaths. Although the pandemic officially ended in 2003, since then, a few more cases resulting from lab accidents or through animal to human transition have popped up. SARS is primarily transmitted person to person, and it demonstrated how fast a virus can spread across the world from individual superspreaders. The global nature of this pandemic emphasized the importance of communication and transparent sharing of information. SARS is viewed as a practice run for COVID, which spreads much faster than SARS, but is less lethal. Our experience with SARS is also providing foundational research for potential COVID vaccines. Looking at the Black Death, the Spanish influenza, and the SARS pandemic, there's obviously a historical precedent of epidemics. The nature of the COVID-19 pandemic is similar yet different from these historical outbreaks. Our world is much more connected than it was a few decades ago, and while beneficial in so many ways, also serves as a breeding ground for COVID-19 and future infectious diseases. So, make sure to tune in next time. We'll be looking at some similarities and differences between past pandemics and COVID-19 and answering the big question, is there anything we can learn from past pandemics about mitigating the effects of COVID-19?